Hi, there are over 50 million Americans in this country with no health insurance. Are you one of them? Everyone either has health insurance or wants health insurance. The only issue is, can they afford it? Or it may have pre-existing conditions. Most health insurance plans for a family will cost you anywhere from $600 to $1,000 a month, depending where you live. In some cities, it can cost you $1,500 to $2,000 a month, and most people cannot afford that. What if you can get that major medical health insurance for you and your family for $150 a month? Would you buy it? Of course you would. Everyone wants it. The issue is, can we afford it? Family Care is a 27-year-old licensed company out of Houston, Texas, that has been providing affordable health care benefits for 27 years. Let's discuss some of those benefits. What if I told you that we had association healthcare savings plans that included limited insurance group benefits from $129.90 a month for a family up to $189.90 a month for an entire family, depending what state you live in? What if I told you that all pre-existing conditions were accepted? What if I told you that no one gets denied? And what if I told you that there were no Social Security numbers needed? What if I told you that besides the network savings, it included the limited group insurance benefits that kick in after 30 days? Let's talk about some of these insurance benefits, and let's ask you some questions. If you had an accident and you had to go to a hospital and you had no health insurance, how do they treat you in the hospital when you say you have no health insurance? Not nice, is it? They may treat you, but you may have to wait a while. Well, what if you had a $9,000 hospital bill? How would you feel about that? How would you feel paying for that? And, of course, we don't want anyone to have an accident, but accidents do occur. Now, what if we had a $5,000 and a $10,000 accident benefit that would actually only had a $100 deductible so that you only had to pay $100? How would you feel about that? What if you had to go to a doctor 2, 3, or 4 times a year for yourself, your spouse, and your children, and every time you went to the doctor, you had to pay $70, $80, or whatever it cost? And if you had to do that 3, 4, 5 times a year, you probably could afford that. But what if we had an insurance benefit that would pay $50 towards that doctor visit 4 times per year per family member? 4 for you, 4 for your spouse. I mean, how many times do you go to a doctor in a year anyway? So let's say you did have to pay $60 or $70 for that doctor visit, but our insurance benefit paid $50 of that, and you only had to pay the difference of $10 to $20. How would you feel about that? What if you had to go to a dentist, and the first time you go, they can charge you for an exam, a cleaning, and x-ray, $100 or $120. What if that exam, cleaning, and x-ray only cost $53 with us, and the insurance benefit paid $50 of the $53, so your cost is only $3? How would you feel about that? What if you had to go to a eye doctor and get glasses, and the glasses will cost you $350, and it only costs you $170 with us? How would you feel about that? What we're trying to ask you is realistic questions of real situations that occur. What if you went to a doctor and you needed some antibiotics, and he gave you a prescription, and the generic prescription cost you $400 or $300? How would you feel about paying that kind of money? What if we had a generic copay prescription card that had a $20 copay or less, and you only paid $20 for those prescriptions instead of $400? How would you feel about that? What if we had a comprehensive wellness profile included in our program where when you're over 30 years of age, every doctor will say you need a physical. And a physical could be very expensive, especially if you need a complete blood work. A complete blood work, also known as a comprehensive wellness profile, can cost $690 per person in Texas and over $850 per person in California. So for a married couple, it could cost you $1,400 to $1,700 a year. What if without a program you had 2 for free per year after a 90-day waiting period for the primary and 180-day for the spouse? What if you had 2 for free per year? That would save you $1,400 to $1,700 by itself. And imagine if you needed extra ones that same year, you only had to pay $97 for each extra one instead of $700 or $850. Folks, is that value? How many thousands of dollars would this plan save you? And it only costs between $129 to $189.90 a month for the entire family. All pre-existing conditions included. No one is denied. No Social Security number. Would you pay $500 a month for a plan like this? Would you pay $400 a month for a plan? As I said, it's only $129.90 to $189.90 a month for the entire family. And depending where you live, it may have a $60 application fee one time or a $100 application fee one time, depending what state you live in. But these programs are available in 47 to 50 states. The only 3 states that's not available is Montana, North Dakota, and Massachusetts. We have a customer service department from Monday to Friday that will answer your questions in 5 different languages: English, Spanish, Korean, Vietnamese, and Chinese. And our customer service will take care of you. If you need anything, when you receive your 2 ID cards and your booklet describing your benefits, call our toll-free customer service to answer any questions. If this sounds like a plan that makes sense to you and you can afford this, and I'm sure you can, get back with the agent to answer any questions you still may have. Thank you. God bless, and have a great day.